Very exciting, up and coming space, growing space.
Yes, welcome everybody. All right, let's go ahead and get started. I know we have a busy, really packed presentation here. And first of all, thank you for joining us. We really appreciate you joining us today for our webinar on creating disease-specific pathways for all your patients in seconds. Specifically, we'll be talking about generative AI. One version of generative AI that most of you have probably heard of is ChatGPT. It's come out like gangbusters since right after Thanksgiving, and we've actually started using it in our system and wanted to share how groundbreaking we've found it. But also we want to talk about what AI is, what generative AI is, in a brief and kind of digestible way, and also go discuss some of the many potential ways it's going to revolutionize, not how it can, but how it will revolutionize healthcare. And I know that's a big thing to say, but I think in this case, it's probably appropriate. So our agenda for today is a little bit of introduction first. We'll do some housekeeping, and then I'll talk a little bit about the generative AI revolution we've seen in the last 6 months alone. From there, I'll hand it over to Brad to talk about the potential and actual real impact of generative AI in healthcare. Then we'll start focusing on pathways, and we'll bring in Pooja on board, our director of product here at Calcium. We'll talk about, actually walk you through how we're using AI, integrated AI into our system to generate personalized pathways for all of your patients, for each patient, and give you some use cases from that. And then we'll have a Q&A. Now, we've already, I'll be honest, we have about 36 questions in our Q&A feed already, but we do invite you to ask your questions as well. And then we'll wrap it up with just a brief discussion of whether this is right for your team. Again, a little bit of housekeeping. If you have any questions, especially for our Q&A, please type it in the chat box on the right-hand side. We will try to answer as many of those as possible. And when we don't answer during the webinar, I'll try to get you some answers outside the webinar. We will have a recording of this event, and we'll make that recording. We'll share the link to that recording to you probably later today or early tomorrow. It depends on how our webinar platform is able to, how soon it can process our recording, and we can get it up to YouTube. The duration of this, we expect our presentation to run about 25, maybe 30 minutes, and then the Q&A. So we'll try to reserve as much time for a Q&A as possible. And then lastly, we'll have instructions at the end if you'd like to learn more about how we're applying AI to improve primary care and how you may want to, try out, this our AI pathway generator for your own process, for your own operations. All right, our presenter today, I'm Ray Villard, digital architect here at Calcium. You've already heard, some of you already heard Brad Ivanovich, our managing partner for sales. And also joining us will be Pooja Wasakar, who's our director of product. So let's jump into it. Some of you may have heard this news article, seen this news article a couple of months ago, that ChatGPT passed the U.S. medical licensing exam without any clinician input. Now, ChatGPT is a publicly available generative AI tool. It's just one of many. So I'm going to be really focusing on generative AI here because that's really the more appropriate term. But it was pretty amazing. It's doing many amazing things, which is why it's so revolutionary. The good news, I want to just give you ahead of time, and we'll address this more later. It's not going to replace the need for human interaction and creativity. It will not replace the need for actual human touch and human care of a caring provider. Now, but let's kind of talk about what's happened in the last 6 months. On November 30th, right after Thanksgiving, OpenAI launched ChatGPT. It was ChatGPT 3.5, actually. And my Twitter feed and my Slack feeds and a lot of my news feeds all blew up as soon as they launched because I'm part of a couple of different AI groups. And I dove into it. I spent the whole weekend just really testing it out. My mind was blown as I went through it. And I actually wrote this whole treatise and sent it out to our leadership team here at Calcium on Monday morning because I was just so blown away. And by December 5th, here's the thing, within 5 days, it already had 1 million users. Now, to put that in context, the record holder for fastest adoption of an app was Instagram, and it took them 2.5 months to get 1 million downloads. ChatGPT did it in 5 days. Facebook, it took them 10 months to get to 1 million users once it officially launched. And that's how that's how amazing this has been. I mean, it currently has 100 million active users and 1.6 billion visitors each month. As I mentioned, ChatGPT was created by OpenAI, but there's a lot of other generative AI programs out there besides GPT and ChatGPT. GPT stands for Generative Pre-trained Transformer. Generative means it actually produces and generates content, not just words though. It does produce a lot of good text content, but it can also produce images and even videos now, and it can also generate audio. Some of you may have seen DALL-E or Midjourney, where it's creating brand new images, both photographs and paintings and artwork, all original, just put together based on the prompts you give it. Now, the key thing in GPT is the transformer. This is the neural network. I'm not going to go, and by the way, I'm not going to go too much into details here. If you want that, reach out to me and I can give you some more resources for that, or discuss a little bit more with you. But really, this has been one of the groundbreaking things that happened, and it only emerged about 8 years ago. And when it first came out, the original creators of this, the researchers who came up with it, didn't realize how groundbreaking it would be. But it has been incredible. Now, it's probably helpful to kind of explain to what GPT is not. So GPT is nothing new. It's been GPT 1.0 launched in 2018, with 117 million parameters. That's its ability to kind of hold different little tidbits of facts or indexes, as it were, parameters, how it holds content. GPT 3.0 launched early last year, with 175 billion parameters. And then 3.5, which is ChatGPT, came out again, as I said, in the end of November, and it had 175 billion parameters. Now, GPT 4.0 came out in March, and I jumped on it, and it's even it blew my mind even more than 3.5 did, because it had 100 trillion parameters. Its production rate was greater. It can hold more content and analyze more content. But here's the thing, as I mentioned before, it's only one of many generative AI tools out there, and it's not necessarily the best. Over the coming weeks and months and probably years, you'll see other AI tools compete with GPT. For those of you who are over 30, you probably remember AOL. They were one of the first ones out of the gate, in the internet, consumer internet boom. Nobody knows them anymore, and you're probably going to see a lot of that. But GPT did open a lot of doors for generative AI, much like AOL did when it started mailing out those DVDs or CDs before. Another thing I want to mention is that GPT is not the Terminator. Okay, GPT and generative AI, at the risk of oversimplification, it's a large language model. It reads and consumes data and content, and then it generates more content or images and videos. But really, for text, it predicts the next word in a sentence and the next sentence in a paragraph and phrases. That's but it consumes so much content that it's able to do it more precisely and more accurately. And ChatGPT, by the way, and GPT in general, is an ANI, that's artificial narrow intelligence. These are AI models with a narrow range of abilities, so they're not really going to turn into the Terminator. For the Terminator, if you're really worried about something like the Terminator, we need to look at AGI. Pay attention to AGI, artificial general intelligence. And then it's older, even more powerful than that is ASI, artificial super intelligence, and that's on par with human capabilities and even further. Those are the ones that we really have to worry about if you're worried about the Terminator. Now, depending on the AI researcher you listen to or speak to, we'll reach some functional AGI within either 7 years or 77 years. We're not really sure because it's still so difficult. But there are efforts to get there. I also want to mention that generative AI is not infallible. You know, as I mentioned before, the pre-trained part of GPT refers to the fact that it consumes all this content, and what it spits out is basically, based on its analysis of that content. Now, it doesn't really understand what it's saying, but based on its predictive models, it knows what words to string together in the right order. Um, so it's great for translation, by the way, and it's great for writing code for apps. And you'll see a lot more of. I know a lot of coders who rely on generative AI to produce 85% of the code they supposedly write, because it's that good. But it's garbage in and garbage out, so it's going to be inherently biased based on what content it's devoured or it's consumed. And there are also occasional inaccuracies. In fact, there's a word for it in the AI community. It's called hallucination. So GPTs, unfortunately, it's been known on rare occasions to make up things, or its predictions or statistics, because it doesn't really know enough about a particular subject, will kind of make up stuff or actually say erroneous things. Now, it doesn't happen very often, and in fact, with GPT 4.0, it happens a lot less. I've run into a lot fewer times with 4.0 than I have with 3.5. But the bottom line is you still need human oversight. You still need human proofing and fact checking to make sure that you're doing this. That you're getting the right. You're promoting or publicizing the right product. But it is getting better. User feedback and continuing increase of how much content it digests and analyzes will continue to help improve GPT and generative AI tools. Nevertheless, it is revolutionary, and I kind of want to start closing out with a little reflection I had last month. I remember, and I'm dating myself here, but when I went to college for my undergrad, for my bachelor's degree, it was pre-Google. So when I had to write my senior thesis, I physically had to go to a library. I had to search library card catalogs. And those of you who are over 40 years old probably remember those card catalogs. Those of you under 40 may not. But I had to take notes on index cards, bring them home, organize them, and then start writing and editing my paper. When I went for my master's degree 10 years ago, it was totally different. For that, I didn't have to go to the library. I didn't go to the library once, except online. And our online library was much bigger than the physical library. So I went on there and actually, I found the books and the papers and research and actually directly found the content I was looking for, found academic papers online, put it together on Word doc right there on my computer, that organized it, wrote it, finished writing it, editing it, and then submitted it. That was my papers. Those were my papers for grad school. Today, though, it's even more revolutionary. So just last month, I finished writing a 40-page ebook on technology requirements for primary care in 2023. It was really well researched. I'm not bragging here because I didn't really do the research, but it was well researched paper. And it took me only about 2 weeks in between all the other things I had to do, where in the past it would have had to take me at least 4 months. Because the way I did it, I just went to GPT 4.0. I have an account there. I asked it to, I gave it my thesis and I told it to create an outline. It did it. Then I asked it to conduct research for all the sections in the outline and write some original draft. And then I went in and copy and pasted it and edited it, rewrote it in my kind of my style. I did some proofing and fact checking, and that was it. And so I was able to do it in less than 2 weeks, what normally would take me a few months. That is what's going on right now. Just as Google changed how we did so many things, how the internet changed how we did so many things from pre-Google days, generative AI and what's going on right now is going to change things for how we do things today, even faster than what we saw in the 2000s. And so with that, I want to hand it over to Brad to kind of now bring this into what's going on with AI and healthcare. Brad?
Yeah, thanks, Ray, for the introduction and kind of the history and background. And I think everybody here has attended this webinar to say, well, where does AI play a role in healthcare or with the digital health platform or the digital health experience. One of the areas where AI shines in digital health and in healthcare is in early disease detection. So since AI has the ability to go through and recognize patterns and outliers, it can detect subtle warning signs that may not have been seen or may have been overlooked by human observers. All right. And today, everybody's into mining big data, and we've got these massive data sets everywhere we go, from the electronic health records, various types of EHRs. Inside of that, AI algorithms can identify hidden associations potentially between symptoms and diseases. This would help a doctor or a care team make more accurate diagnoses and potentially intervene at the earliest possible stage. And as we all know, early detection is so important and can literally be the difference between life or death in certain patients with certain disease states. So AI can be a super valuable ally when layered appropriately on into a digital health platform alongside of a clinical care team. Besides diagnosing and early detection, treatment planning and personalization, personalized medicine are other areas where AI can really revolutionize healthcare. Analyzing large data sets, again, of patient data, it can identify patterns that determine the effectiveness of different treatments for specific conditions. It would enable providers to develop personalized treatment plans tailored for individual patients, right? Individualized care, patient-driven care versus schedule-driven care or reactive care. And that allows the care team to really maximize efficiencies and minimize potential side effects in some cases. I think we can hop to the next slide. With this technology, again, layered over a digital experience in healthcare, it can predict patient responses to specific therapies, allow proactive adjustments, and reducing, potentially a trial and error period of treatment. Just really be there alongside the care team. Next slide. I think the biggest one, especially post-COVID for everybody in healthcare, no matter where you're at in the care continuum, beyond diagnosis, beyond treatment, AI can streamline healthcare operations. Everybody, I think, has experienced their fair share of wearing multiple hats and being burdened by administrative tasks and things that aren't directly correlated with patient care. So by automating routine administrative tasks, such as maybe billing or coding, could free up valuable time for healthcare professionals to focus on what they do best, and that is provide direct patient care, right? Next slide. Again, with the more non-clinical parts of how AI can affect healthcare's in things like supply chain and analyzing, different operational functionality. I think that everybody would agree that there is some transformation that is happening with healthcare, is happening with AI, but harnessing like the computational power of pattern recognition could certainly accelerate that administrative piece, which will then lead to better outcomes in an era of personalized medication. So again, the goal is to not replace people with AI, but have AI as a true partner, as a tool, and a valuable tool, working hand in hand with medical professionals to create a future where diseases are conquered more effectively and lives are saved, ultimately leading to a better work-life balance for the care team and everybody involved, and better outcomes for the patients. Now, before I turn it over to Pooja, I want to talk a little bit about the Calcium platform. The Calcium platform is a digital health platform that is made up of 3 separate components. One of those components being Calcium Core. This is where the care team lives. This is where the physicians live. This is where the clinicians live. This is your view into what your patients are doing, what as far as biometric markers, as far as social determinants of health, insights on other data points that are coming from data aggregation, and providing you a 360-degree view of your patient population. Another component of the Calcium Digital Health Platform is Calcium Studio. Inside of Calcium Studio is really where AI becomes super handy, because in Calcium Studio, it's a tool, it's a self-serving tool that allows your team to go out and create pathways or care plans to directly engage patients, maybe of a certain payer, maybe of a certain disease state. But these pathways could be created. You could create one pathway, you can create a million pathways. You could send a pathway to one patient, you could send it to a million patient. The data set the Calcium Studio is eliciting is truly infinite. And this is where we see AI really helping write and curate those pathways or care plans. The third component is the Health Super App. It's what the patient or the individual or the member or consumer would see. It's patient facing. It allows to pick up those data points from Calcium Studio via the pathways. We integrate with over 550 medical and non-medical devices. So your standard, more traditional blood pressure devices, weight scales, glucometers, peak flow meters, just to name a few, but also your wearables, your Apple Health, your Garmin, your Fitbits, all are coming into a smartphone environment and coming back into Calcium Core so that you and the patient can discuss what is best suited for their treatment plan. So that's the platform on a high level. Looking forward to some questions about anything towards the end, but for now, I'm going to turn it over to Pooja, and she's going to jump into kind of a story on how the Calcium platform and AI would work together.
Thank you, Brad and Ray, for the amazing introduction on AI and like how AI can help in healthcare. Today, we would like to focus on how this generative AI can help provide personalized care to the patients. So to begin with, let me start with Mathew Story. Like Ken is a 55-year-old man with hypertension. He's pre-diabetic. He's struggling with his weight. He has a good healthy lifestyle from a diet perspective, from emotional health perspective, and the social community aspect perspective, but he does have a sedentary lifestyle, which is like probably impacting his obesity and like weight. uh, to look at his health journey, it has been a really long health history. Being a 55-year-old man, he has a long journey and a history of health. He has been to 15 different providers, 3 different hospitals across 3 states and multiple health systems. Uh, so overall, his health journey has been a little confusing and not really easy. To begin with, just the health data, like to access his health data, he probably has like 5 different MyChart accounts. And on top of it, he uses his wearable devices like Apple Health. He has a blood pressure monitor that he uses to keep track of his blood pressure. He uses probably 10 different apps to manage his look at his nutrition and other aspects of his health. So it's just that overall, it's been confusing for him a little bit. Recently, let's say he started working with ABC Health, and to and started using the calcium app. So let me now, with that as a background, let me now show you the calcium app and like what Ken's experience looks like now in the calcium app. Give me 1 second. I'm just sharing my screen here. So this is the calcium app is available on multiple different, it's really accessible and available on multiple different devices. You can download it on the phone, tablet, or even use it on a browser. I'm using it on a browser right now for the demo environment, and I'm showing it to you how it would really look like in an app. Most of our users really uses the app version and download it on their phone. So this is what the home screen looks like. What you see on the top over here is really his circle of health, where Ken has configured this top portion to like really access most important data for him. So his heart rate, his blood pressure, his steps, activity. So he has all these data points at fingertip and has configured this home screen to what best suits him. What you see in the center is my health index. So this is what, as the name suggests, it's not really a score telling Ken how his overall health is, but it's really an index, a motivator that tells him how he and helps Ken keep motivated and compete with himself. It is more taking into account all the different data points like his sleep, his nutrition, his physical activity, his medical records, and even his engagement, like how engaged he is in his improving in his own health. It considers all of that into account, and this is one way we use AI to like help Ken understand his overall health, but also help him motivate to take the right steps, because as he takes one right step in the right direction, this health index starts improving. So it's more like he's competing with himself, like what he did yesterday versus today, and like how it has impacted his health. um, So, as we saw initially, like his health journey has been confusing with all the different accounts and devices that he uses. So, this health data, like what Calcium app also provides him, is a 360-degree view of his own health data across all the different apps and devices that he uses, like to a weighing scale, for example, for monitoring his weight, the Apple Watch that he uses for steps, and the eye health device that blood pressure cuff that he uses for monitoring his blood pressure. All that data, all that different data from all those different devices automatically, and we also like to use the word automagically, comes into Calcium. We integrate with all around 500 plus devices that would pull the data automatically in here for Ken. Along with that, he also see all his records across all those 15 different providers all in one place. So we pull all his records as well for him together in one place, so he doesn't have to go into 5 different locations, 5 different places. With this, he has an ability to not only share all this health data with the providers, but also his loved ones. So, like for example, if his kids, his son is really interested in monitoring his health, he could share all of this data with his loved ones, with his son as well, along with the care team and the providers. The other aspect that helped Ken and his healthcare experience was the personalized pathways. So ABC Health has like sent him, because he's an hypertension patient, he has this hypertension management pathway. They're also doing remotely tracking as he is and doing some RPM services as he is uh, hypertensive as well as pre-diabetic. And this also, they also send him like the surveys as and when needed. This helps ABC Health keep their star ratings up and improving, as they can send these surveys automatically via the Calcium platform. To look at the hypertension management, Ken is really focused on improving his hypertension right now. He is monitoring his blood pressure every day. He can see that his sedentary lifestyle has like his provider, his doctor has told him to like improve that. So he's monitoring his steps as well over here in this pathway, and he can see how he's progressing in this. He's also learning about hypertension, like what is hypertension, understanding hypertension, and what is good for you, what would work for you and not. But Ken is a little confused. This is a little bit more generic pathway that ABC Health utilizes with all their hypertension patients. his specific need is a little different. He is pre-diabetic, he's struggling with obesity as well as borderline obese. So he's confused on how these other aspects impact his health and how can he consider all the different aspects of being pre-diabetic and obese as well as hypertensive to improve his health. So that's when he went to his provider with the confusion, and the doctor could easily utilize what you see here is a calcium studio platform. This is what our doctors, our providers, our care teams, clinical, non-clinical staff can utilize to look at and create pathways and create those personalized pathways for the patients and patient population. To save time, what I have is like I've already pre-typed some of this text. So sorry, let me go back. So over here, when you create a new pathway, you could select the topic on like what do you want this pathway to address. We want this particular pathway for Ken to address hypertension with comorbidity and obesity and pre-diabetes, and we want it to include like medication reminders, exercise, and education on self-management technique. Really, the goal here is to like help Ken monitor and control his blood pressure, like help him be engaged and self manage his condition. So, to begin with, we would like to start with a 14-day pathway to see if this is really helping Ken or not. So, like to begin with a 14-day pathway, we can create it for a specific age group and, like, say, hey, Ken is 55-year-old, and let's build it specifically for Ken. Or ABC Health can look at our core platform and see most of their male patient population who has hypertension have prediabetes and obesity. So, like, it would help everyone, all their male patients. So they could really create this pathway for that entire segment of their patient population. So let's take that as an example and generate this pathway. So what is happening right now is our AI tool is like looking through all the different data and resources available online, as well as all the other pathways that we have created in past, to look at what would be most beneficial and helpful to Ken or to pay male patients who are struggling with hypertension and are pre-diabetic. And it comes up with a very specific plan, 14-day plan for Ken. It starts with like, hey, every day take the prescribed medication, so like sending those reminders on a daily basis, exercise routine for a daily exercise routine for 30 minutes, some education. So like each day you would see the education topic is changing. The first one is read up on hypertension and obesity. The second one is research on lifestyle and changes in management. And let's say really we want him to like focus on mindful eating on second day. You could easily go in here and change this and say mindful eating is important, and like helping him understand how his eating habits not only impacts his hypertension but also the diabetic condition, and how he needs to like look at both sodium as well as the carbs and how it would help him. So you could edit that. The providers or the care team members could edit this as they see fit. This is where it comes to like that manual intervention is still important. This is generated by an AI as a suggestion or a recommendation. It is helping you like come up with the plan easily, but really reviewing this and approving it and going through it to see if this really would help your patient population or your personal interaction and the relationship that you have with your patients. Is this really meaningful to them, and also the experience that you have, right? So all of that you could apply to update this. This is meant to be more helping you for a starting point and not have that writer's block or not have that, hey, where do I begin with? So it's more for that. And then once you approve, you can then create this pathway and publish it and send it over to Ken on the app very easily. To save time right now, what I have done is like we have already created this pathway. So let me show you how the experience now would change for Ken. So going back over here to the home screen, I'm going to this specific pathway now, which says hypertension with comorbidity for obesity and diabetes, pre-diabetes. So now you saw earlier the tasks were a little different. They were learning more around hypertension, But now, as you see, now we have assigned this to Ken, and like the first day, he's still learning about hypertension. He's still learning about that, but he also has some activity around doing an exercise, a 30-minute exercise daily. This is helping him tell like, okay, 30 minutes of cardio is what is needed. He could pick and choose what works best for him, like walking, riding a bike, swimming, yoga, whatever works. He can pick a different activity daily, or continue to stay on one activity. He can also use this timer up here to like use that, or he can use any other apps that we integrate with, like do the cardio exercise 30 minutes daily, record it there, and we will pull that data automatically in the app. So that is something that he would be doing every day. He would be also learning a new topic every day. So let's say like hypertension is what he's learning, and the high blood pressure and how to treat that is what he's learning. There's video that can be embedded in here. You can add images. All these pages are completely configurable, and those get created to create that engaging experience within the app. So he's learning about that. And then towards the end of the day, with to help with the self-management techniques, the pathway and the AI generator also thought like there has to be an update journal task, like which helps him document and note down what he learned today, what he learned new about hypertension today, and what is that one small step he's going to take to improve his health. Might be he might say that, hey, I need to start this 30-minute cardio, which I've been not doing till now. I have to do it. So that might be that one step that he can document and say, this is what I'm going to make a change. Say if he had learned about mindful eating today, he could have said that I'm going to start counting my carbs. Even that would be a big step to, as he's pre-diabetic, to like just keep a count and understand what does his carb intake look like today. And also because he was confused, now ABC Health can also ask him to like rate in this first 14 days, like is this helping him self-manage better? Is this helping him learn about all his conditions and how to improve his overall health? Today Ken feels pretty, he's not yet sure. He's still learned about hypertension. He's not yet learned about diabetes and obesity. So he's not sure. And maybe he says 6 or 7 or something like that today. But as he goes through this on a daily basis, this rating might increase or decrease. And this is how both he and ABC Health can like monitor how he's progressing and learning about self-management techniques. Now, to just give an example of like the future tasks that have been created, like he's updating the journal every day. On day 2, he starts to check his blood pressure and learn about mindful eating. As I changed it to like say, like on day 2, we want him to learn about mindful eating. And he's learning how to start using a blood pressure cuff. And he's also starting to monitor his weight starting day 2. And so on, like every day you would see there's a new topic he's learning about medications for hypertension. He is making a small change every day, which is like diet and lifestyle is the first change, and where he's starting to create a plan on how he's going to, whatever he's learning, how would he create a plan and like implement that to help improve his overall health. Now, with Calcium, this has been great. Like he's received the 360-degree view of his data. He's received these personalized pathways, which has been even further personalized for him. He also received these reminders and notifications on time to check his blood glucose levels, or like if he was invited to a new pathway, or to take his medications on time. So all of those reminders come to him directly on the app over here. So overall, it has just helped him. Thus, easy to use Calcium app has overall helped him make healthcare and like what he needs to do a little less confusing and also fun to use to manage his overall health. There is a lot more that we can do, like as today's topic was more around like how we can create personalized pathways, we are focusing more on that. But with the 360-degree view of data, not only Ken is benefiting, but ABC Health is benefiting as well. They can see a patient and their entire health history and all the health data and analyze more if someone is really struggling. They can look at a pathway like the hypertension pathway or the hypertension with comorbidity pathway. They can make a pathway for one individual or a million individuals at a time, and they can also track how that pathway is performing and then tweak it and improve it and publish it with a click of a button to all their patient population. At the same time, you can also manage and track your entire patient population, see how your patient population is really doing, what segments, analyze and segment different population to create and improve the health pathways. And all of this is like really designed in a way to help you, give you the real-time insights, give you reminders, alerts and notification when your attention is needed, and help you automate some of these workflows like calling people, asking them to monitor their blood pressure, or sending surveys to people, or some of those manual, time consuming activities. All of those could be automated via Calcium platform.
Great. Thank you so much, Pooja. And now we want to start our Q&A, and we do have dozens of questions that people already submitted even before the event. And so we're going to jump into it now and try to answer as many of those as well as any new ones that have come in since then. So to kick it off, I'm going to turn to Brad with the first question. It's from Kabran Chapik. And he asks, will my job be replaced by AI, or will I get paid less because of AI? I think, Brad, you might be muted. So
yeah, just searching for the buttons. Yeah. So it's a great question, and I think it's a question that comes up often is when we talk about automation. Is will the robots take over my job? And I think specifically in healthcare, as I mentioned earlier, we're always tasked with doing more with less. Our workload goes up, reimbursement goes down or stays the same. We haven't seen an area yet where AI has taken place of a clinician. Going back to, I think what I was alluding to a little earlier in the call is what it does do is it allows clinicians to be clinicians and takes that administrative burden and lessens it greatly, leading to not only of the things that we discussed at the beginning of the call about better diagnoses, better treatment, faster diagnoses, but a better work-life balance for the folks that are working on the clinical team, that don't have to worry about that administrative burden.
All right. Thanks a lot, Brad. And for our next question, I'm actually going to send this over to Pooja, and we've had a few people ask this. Probably the quickest question was from Casey Tramp, and he asked, does this comply with HIPAA? Is this HIPAA compliant? A few people have actually asked that.
Yeah, so our platform is completely HIPAA compliant. We have multiple features from like health data. We take security and the HIPAA regulations very seriously as we are dealing with medical records and people's personal privacy and data. So all the interactions, including the AI technology that we use, we make sure that it is HIPAA compliant. Though AI or generative AI in general probably might not be HIPAA compliant on its own. So like, for example, if you're using ChatGPT online to like understand what a pathway or program to create, that might not be HIPAA compliant.
Yeah, good point. The next question is, there's actually a few people who've asked about what content GPT and other generative AIs have consumed and learned from and were pre-trained on. And Ann Sherman actually asked, does AI only draw from refereed or peer-reviewed journals? And the question is, no, it's a generative AI, GPT, essentially has digested and examined almost every content publicly available on the web before 2022. Now, it's actually expanding in 2022 now with GPT 4.0. And in addition to that, it's also devoured a lot of content that's licensed. So it's not publicly available on the web. So to give you an example of that, this ebook I wrote for technology requirements and demands in 2023 for primary care, I asked GPT to do the research, and it pulled a lot of research content from studies, academic studies, published studies from the England Journal of Medicine, from the NIH, and I also saw it from Springer. And some of you who've done, have access to Springer, they have quite a library, but it's all licensed, and so you have to pay a fee to access their content. So to answer your question, it draws from everything publicly available on the web now, and those and licensed content or closed off content as well when it identifies large groups, large grouping of content. Next, I want to turn over this question to Brad, which is how can AI be used in functional medicine to integrate patient history and multiple labs to prioritize and improve protocol recommendations? That's from Tressa Brendel.
Yeah, and I think I saw even a couple of other questions about functional medicine in the chat. So it's probably a little longer than just a high-level explanation. But we talked about calcium, the calcium digital health platform today with AI. If we were having just a functional medicine integrative health conversation about how calcium works with these folks, which we do work with a number of them, calcium provides a platform where in many cases traditional EHR doesn't capture what integrative health and functional medicine folks are looking for necessarily. And with the Calcium Studio, with the pathways themselves, whether it be AI generated or generated from another care plan that the care team has put together, it's able to elicit an infinite amount of data points, right? So Calcium would be the platform that you're using to interface with the patients to collect data points for integrative health and medicine purposes. Layering the AI over that would kind of be secondary to layering that into Calcium Studio. So I would love to have more of an in-depth conversation. I put my email in the chat. Would love to have more of an in-depth conversation on where calcium helps functional and integrative health. So please don't hesitate to reach out to me there.
Well, Brad, while I have you on, I think you could probably answer the next question, which was also asked by a few people, and then it's one of the first ones that asked this was Dr. Daniel Domian. And he asked, what will it cost? What will this AI pathway generator cost in these AI tools?
It's a great question because it adds a ton of value. You would probably guess that there would be a cost to it. But if you're a Calcium customer and you're on the Calcium platform, this is included. Just like any other feature or function that we developed or have developed over the last 4 years, once it becomes live, it's live for everyone. So that is how we've operated up to this point with over 550 customer organizations. And that's how we will continue to operate. So every time there's an upgrade, every time there's another feature or function built into Calcium, layered onto Calcium, it'll be available at no cost.
Great. This sounds a little bit more this next question sounds a little bit more technical, and it's from Dr. Michael Blackman of Green White Health. And so, Pooja, I was wondering if you could answer this. How do we integrate this to our existing workflows?
A good question. So I have twofold answer to that. So the first thing is how do we get the data? So we connect to the consortiums like Commonwealth Care Quality, HINs, and HIEs to get all that patient history and medical records. In Ken's example, all those 15 different doctors he was working with over his lifetime, we get all that data not through those one-on-one integrations with the EHR system, but we really integrate with these consortiums to get that data all together in one place. The other way is the workflow on how it impacts your day-to-day life. I saw a question in the chat as well about is this integrated with Epic? So so we can integrate to any EHR system in a way from a workflow perspective. So you see all that patient data from other providers, from providers out of network, from other health systems, as well as like the device data or like the data you're requesting, like the survey for whether this pathway is working for you or not, all of that. The interactions of patient in the calcium app, you can see all of that data in the Epic or Cerner or like whatever EHR system you're using. So for that, what we do is like we use a technology called Smart on Fire. So all these bigger, larger EHR systems are already utilizing the Fire technology, and then they have enabled the Smart on Fire technology where a tool like calcium can be embedded within the EHR system. So it makes it more efficient for the care team members, the providers, clinical as well as non-clinical staff to access the calcium platform.
Great. Thank you, Pooja. Well, we're almost to the top of the hour, and I want to turn it over to Brad to bring us home and kind of wrap this up with a question of, is this right for you? Is AI and the calcium platform way of doing it right for you?
Yeah, thanks, Ray, and thanks for everybody for joining. The way I see AI, and I think that the way that a lot of healthcare providers are seeing AI is the level of utilization with AI will vary from organization to organization. But it's safe to say that no matter what part of the care continuum you are in, you will be seeing AI more and more and more and more in healthcare, right? A digital health platform for both patients and providers, coupled with artificial intelligence, is one of the only ways, or one of the best ways, that we're going to have to improve patient outcomes and improve work-life balance for everybody involved in healthcare. So again, thanks for coming. Would love to talk more about some of the questions in the chat that we didn't get to. I have put my email in the chat several times. I would love to be the point person for that. Here it is again on the screen. You're going to get a copy of this presentation, I believe, right, Ray?
Yes.
And in that correspondence will be my contact information also.
All right. Thank you so much, Brad, and thank you everybody for joining us. It was great sharing, sharing this webinar with you. It's really been an exciting time for us exploring how we can use AI, generative AI, to continually evolve our platform and make sure that it actually can do more for you, as Brad has mentioned a few times today. Again, we'll be sending out an email with links to the recording of this event. Also, if you want to set up a time with Brad and his team to learn more about our system, see it for yourself, to see if this is really, this could really help your team, please don't hesitate to reach out, and have a good rest of your day. And we look forward to talking to you soon. Thanks, everybody.
Thank you.
Thank you, everyone. Bye.